So the reason why we started the Minority Men's Health Fair and the Minority Men's Health Center was to address the healthcare disparities that disproportionately, especially afflict men of color. The reason we chose the subset of men is because we are urologists. The Glickman Urological Institute, #1 urology program in the country, but as urologists, one of our major diseases that we focus on is prostate cancer. And we noted, looking at the broad landscape of the healthcare landscape, we noticed that there were a number of healthcare disparities that especially disproportionately afflict men of color, and prostate cancer was one of the most striking healthcare disparities, in that African American males develop and die from prostate cancer twice as often as their white male counterparts. And we at Cleveland Clinic felt that we could do something about it. There are a number of reasons as to why we believe these healthcare disparities exist with respect to prostate cancer and other conditions. A lot of it has to do with health literacy or lack of education, lack of knowledge and awareness in terms of what is needed for one to stay healthy, for the early detection of disease. A lot of individuals, especially when it comes to men, a lot of men are afraid to go to the doctor. A lot of men feel that if they don't have any signs or symptoms or pain or discomfort, there's no need for them to go to the doctor. And what we found is, in the literature also, that African American males in particular, oftentimes they present at later stages of having prostate cancer. And so, we felt that if we could educate men and also provide a location or mechanism for them to come in and get screenings for the early detection of disease, we might actually be able to reduce some of the healthcare disparities that we see in terms of morbidity and mortality associated with prostate cancer. Also, it is known that prostate cancer, there are hereditary factors associated with prostate cancer, and we do know that African American men do have a higher incidence of hereditary prostate cancer. Hence the American Urological Association recommendation that black men should start screening for prostate cancer at the age of 40, whereas the guidelines for white men are that they don't have to start until they're at age 55 unless they have a strong family history themselves. So there are a variety of factors that contribute to the health disparities, the incidence, but also there are a variety of factors that contribute to the disparate outcomes. And a lot of it is related to education. And at the health fair, we provide free health screenings, which is access. We're trying to break down a lot of the barriers that have historically prevented the men from getting those screenings that they so desperately need. The Minority Men's Health Center is a year-round center here at Cleveland Clinic main campus, and we have some other locations up in Northeast Ohio. And so we're an access center, so if we find an abnormality to health care, for example, we can get the men into the healthcare system here at Cleveland Clinic and address those healthcare disparities.